Lane should open the meeting, not a mod.
Yes. I'm just going to wait one more minute to allow people to join the meeting. And Ahmad, this is being streamed on, or is it just WebEx? No. Okay.
Yeah, I think it's just on WebEx. We will record just so we have the information. We'll make that announcement recording this part just so we have a record of it to be able to transcribe anything. But yeah, it's just WebEx.
Okay. Well, I will call the public hearing to order. Thank you everyone for being in attendance. I know it's 3 o'clock, so we will have our Behavioral Health Board following this at our regularly scheduled time, 3:30. But I would like to, again, thank you everyone. And this is the public hearing for Mental Health Services Act 3-year plan for 2020 through 2023 and annual update for 2019 through 2020. We will just start with a summary from Ahmad, and then after attendees can make public comments just regarding the annual update, and we'll make sure that those are transcribed. Behavioral Health Board members, I will ask that you refrain from making any initial comments just so that we can have the public make their input, and then we will be voting not at the public hearing right away, but at our, again, regular scheduled meeting. Any questions before we start? Okay, Ahmad, I will pass the mic off to you.
Thank you, Kylene. Let me try to share this with everyone. It's worked in the testing run, so hopefully it'll work here. So as Kylene said, this is part of our Mental Health Services Act annual update public hearing here on July 16th, 2022. I'm Ahmad Brahmi. For anyone who's on the call that's new, that's not been to one of our hearings. I'm one of the division managers here at the Department of Behavioral Health, and my team works on developing the MHSA 3-year plan, the annual updates, and any subsequent reports or outcomes or other things like that, as well as working with the fiscal division and their MHSA. But this work requires work across divisions. We just happen to be the one that do these public hearings and do this aspect of it. So this is the official public hearing for this year's annual update, and I'll dive a little bit more into the different levels of those and what we do every so often. Just a warning, this is being recorded. We are recording this meeting, and that's primarily for us to be able to go back later and document and transcribe if there's a lot of questions or comments or things like that, because those need to be included in the final plan as well. Here in Fresno County, we started doing a land acknowledgement anytime we're having any kind of a significant event. So in this case, this public hearing, we do want to open it with our land acknowledgement. And that is that the Fresno County Department of Behavioral Health acknowledges that we are on the traditional lands of several nations, including the Yokuts, the Western Mono Manachi, Eastern Mono Manachi, Nimu, Ohlone, that's one I'm still practicing on, and the Silean peoples. And we always kick off our behavioral board meeting when our team presents with the mission statement. And so we thought it would be appropriate to include it here in a public hearing as well. And that's the Fresno County Department of Behavioral Health, in partnership with our diverse community, is dedicated to providing quality, culturally responsive, and behavioral services that promote wellness, recovery, and resiliency for the individuals and the families in our community. With that said, I'm going to do a quick overview of what is the public hearing. So you'll be able to see most of the information on the screen. I'm not going to read every one of those bullet points, but just do touch on them. We are required to do new MHSA plan every 3 years. In between those years of the 3-year plan, we do the annual updates, as Kylene mentioned. So this is the annual update to the 2020-2023 3-year plan. The update, anytime we make changes to the plan, we add to the plan, bring on new projects, things like that. We do need to do an update to the plan and also hold a public hearing. We try to do all those things at once so we're not having multiple hearings throughout the year. Luckily, we haven't had to make a lot of changes in the past few years, but if we were to make midway through changes, we would then need to be able to do it through a public comment process, public hearing, etc. The plans require us to have community input in developing the plan and the annual updates that best meet the needs of our community and to try to address any changes. We've tried to do that the best we can with the COVID restrictions. So this year for our annual update, we did 4 different virtual public hearings. We did one in the evening in English to allow people that were not maybe able to participate during the day with their work to participate. We did another live one at a lunch hour, allowing people maybe to be able to participate on their lunch break. We did one fully in Spanish. We did one in Hmong, and I think that may have been like the largest attended one. And then we do something additionally in Fresno County where we've incorporated what we call a report back session. So after we have those public hearings and we take the information and we start to compile it together and look at how that's going to influence and drive the plan or what changes are going to be made, we then come back and have what we call a report back session. It's not something that most counties do. It's just something that we opted to do to really just inform our community of that we heard them, what we're doing with the information they shared with us, and also how we're going to be trying to implement some of those recommendations. It also allows us to let our stakeholders know what's going to be in the plan before it comes out, so that when they see the 30-day, when the plan is out for 30-day public comment, people aren't caught off guard. They're not or they don't go through and say, hey, none of my concerns were addressed in here. We try to address those maybe in that report back session and provide some context and framework. So we also had 3, like I said, of those report back sessions. We did post a plan for the 30-day public comment starting January 14th. So we've had a month of the plan being available. We did post it on our website. We did make note of it on some of our social media, and a lot of you probably got the information through an email listserv, which is an ongoing list that we try to compile for people that have expressed interest in receiving information about our work around MHSA. Today we're having the public hearing. And so part of the public hearing is we're going to seek to address any questions anyone may have, provide any clarification. We will share the public comment that we did receive thus far during the 30 days. And also at that point, just making sure that everyone is on the same page with the plan, in which we'll then, I don't want to say submit it, but we will then turn it back over to the behavioral board. And as Kylie mentioned, the board will accept the plan in their hearing. And then from there, we submit it to our board of supervisors because it's required to have that board of supervisor approval. And then from there, we have 30 days to submit those to the various state organizations that have jurisdiction or supervision over the Mental Health Services Act. And those are, in this case, Department of Healthcare Services and the Mental Health Services Oversight and Accountability Commission. I used acronyms because I felt people may not want to hear me say all of those every single time. If you do have questions at any point on what is an acronym or something I said, please put it in the chat or just jot it down and definitely ask when we get to the public comment section. Just a quick overview of the annual update. We talked about the public listening forums or our public community planning processes that we held virtually. We noted then, as well as in our report back sessions, that the county is not adding any new programs to this current plan. There were several changes during in the annual update that we did want to call out, and we spoke about these in all 4 of our community planning sessions, the virtual ones, as well as in our report back session. One, which is not a major one, but we did need to call out, is with one of the diversion programs that does utilize some MHSA funding. There's a request or an attempt for us to move unspent funds in some of the outreach components of that program and really move that to where the money is needed more right now, which is for the actual direct service and some of the clinical supports. So that was a change because we're changing a budget line item on a program that was basically reducing some of the outreach component of it. We felt it was something that we needed to include in the plan. We had conversations during our community planning process about some one-time funds. It was about $206,000 of some one-time housing funds that we needed to spend by June 30th, a very short period of time. And so we had solicited some input from our stakeholders during those sessions on some ideas. There were some recommendations for training and some other items. So then what we did is during the time in between those community forums and our report back sessions, we went back and really looked at what are the things that we could or could not do with the funds, what would be allowable use funds, but also what are ways that we can ensure we can spend down as much of those funds on the services or programs that are permitted in the short window that we had. And so for those ones, the things that we're going to be focusing on with the one-time housing funds is developing welcome bags. So kind of as individuals move into permanent supported housing, being able to get what we're calling welcome bags that'll have more of things that people would need when you're moving into any kind of a new home, mops, buckets, brooms, cleaning supplies, things like that. Also, what we're calling general just house goods. So some canned and dry goods just to allow someone to have some foods or some other items they may need until they get a chance to obtain those on their own. The project is also going to utilize some of those funds to try to cover what we're calling moving costs. So those could be anything from deposits. It could be deposits for the rent, could be a deposit for utilities to get PG&E turned on, things of that sort. Again, moving costs. And those are things that are allowable under the regulations, but they were also things that our housing team felt that they could do in an expedited fashion to try to utilize as much of that money before June 30th. So that's kind of what we're doing with the one-time housing funds. There were 3 projects that we were deleting, and we did emphasize and stress, and I think everyone understood those, but I just wanted to reiterate. The programs that we're deleting were programs that were never either utilized or come to fruition. So us deleting those programs will not have any impact on any program, any jobs, any individuals served. The deletion of programs was a standalone acting for adults that we were not able to lift up and set up. However, with most of our services now, we're going with a full model, a continuum of care model that includes ACT. So instead of having a separate standalone ACT program, a lot of our programs now will include an ACT level of care within that continuum of care. The other one that was going to be deleted was trying to get the exact name, it was integrated wellness activities. So that was funding set aside for activities for outpatient services, and over the course of 2 cycles with our 3-year plan, the money just was not utilized. And based on wanting to really maximize the limited funding, right now we felt it would be best to delete that and shift some of those monies to other existing programs where they do need some of those resources. And the last one was eliminating the continuum of care for persons affected by human trafficking. You may remember this was a project proposed in our last 3-year plan. We did carry it over into our new 3-year plan. It did go through an RFP. The RFP was not accepted. And from the time this was envisioned, along with COVID and just to where some of the resources that are available now, we felt that the individuals that would be served by that program could be served through a lot of our other current programs. And so it would not make sense when we have limited resources to try to create yet another program when we could serve individuals with those programs and just leverage some of the other opportunities that are out there. So again, we talked about this during our community planning process. The 3 deletions were things that were not going to impact anyone in terms of jobs or take away services from anyone who was receiving them. The last one I just wanted to note was that we had worked on an innovation project looking at coming up with an innovation project for youth that was going to be developed by youth. We did go through that project that experienced a lot of delays because of COVID. We did get the final proposal, and after review and having some discussions, it just was not a viable project as an innovation plan. We did report this out to the behavioral board. I want to say maybe like 2 months ago, Kylie. I can't exact, but what we have done with it is we have forwarded the concept of that to CPEN that was looking at some ideas and projects along those lines. And we're continuing work within our innovation community planning process plan to look at, again, trying something new, working with youth to develop a program for and by youth. So we didn't do that one particular proposal, but we are moving forward, and there's aspects of that report or proposal that the youth put forth that we do think is really interesting and viable. And so we're looking at how we can incorporate some of those into other activities. The last one that is not in this plan, but we did mention it in our community planning process is that as we're evaluating all of our programs, what we did start out with our PEI programs initially is looking at several programs that are funded under PEI that are county operated that we are exploring moving them out of PEI and potentially funding them with other funding sources, so that we're not utilizing PEI, MHSA, which is supposed to be the funding of last resort. So we're trying to see if we can utilize some of the existing funding, and also utilizing other funding may make the program function a lot easier, based on some of the reporting requirements and parameters that having the program as a PEI does have on it. So that'll probably be in the next plan, but as of right now, those three deletions and the things you see on the screen are the only ones we have going on. And then in the annual update, we had talked about just capacity and also budget considerations. We want to make sure that we have the capacity to put new programs, lift up new programs and sustain them. We have really looked at sustainability models. We've looked at not having programs that are siloed, but really creating a true continuum of care in a system of care. And so those are some of the things that we're focused on right now, which is strengthening our current programs, assessing and evaluating all of our programs, getting ourselves to a place where when we move forward to try to add programs and services, we're not just putting out services to address a single issue, but really looking at how, when we put something out, can it address and incorporate and linkage and leverage a lot of our other programs and services. We did get some feedback during the 30-day public comment. We did receive one, which is the one on there that you'll see, which was we were missing a program sheet on our C-bands, which is a culturally based access navigation services. And I think it's between 70 and 100 programs. The fact that we only missed one, I'm surprised, and that was just an error. So what we did is when we were informed of that, we did pull the sheet, make sure it was updated, and then we sent that out to everyone on the listserv so they would get a chance to review it. And we didn't get really any feedback on the grammar and format issues, and I think that's because we did call it out. And I think a lot of you who have been involved with this process with us over the past couple of years know that by the time we get a final product that we put out, we do go through and make sure that we add all the table of contents, add all the information, page numbers, right? That was something that we didn't have a couple of years back, page numbers. So all of those things will be added into the final version. And so really the only feedback we had received up to today was, a rightfully acknowledgement that, hey, we were missing one of the program forms, and we were able to get that. One of the things that we're going to be adding to the final copy is going to be basically a breakdown for each of the MHSA components. So if you guys look on the program sheets, it has a breakdown for what each program is, but this will just be an easy breakdown for someone to see, like, okay, well, how much money is actually spent on CSS? How much money in total is spent on PEI? How much is total spent on innovation, et cetera, so that you don't have to go through all the program sheets and tally up all the project amounts to be able to get that figure. And the last thing that we're adding to, and we wanted to bring to you guys' attention, is our annual revenue and expenditure report. Those are due in January of every year. Every year, the state has utilized a different format, a different formula. They have finally landed on a formula. They wanted everyone to do it through a specific website and protocol, and then their website did not work till the end of the month. But we did get that in on time. That is actually posted on our website as our previous RERs. And so we're going to be including that in the report, and that's really more for long-term use, being that if someone wants to go back and look at that annual update or the plans and the RER and they want to compare, they're not having to look in multiple places. 5 years from now, they can pull that one document, and everything that's related to that will be in one place, although the state has a submitted report those separately. Hopefully we've covered everything in there. We're going to go over now to the public comment portion. I apologize for going longer. We wanted to make sure we provide as ample time for people to have questions, comments. We just do ask that if you have a question or comment, just know that we are recording this, and that's just so that we can transcribe and make sure that it's included. We are required to include all of the comments or questions within our plan. I think in our last plan, we had 200 pages of questions and answers that we received, and it was more around a specific program, but those were included in there. And we just ask for you to just speak slowly so staff that are taking notes are able to do so. And then also when we go back later and need to use this footage to transcribe, it'll be easier for us to do that. With that said, if there's any questions or comments related to the annual update, I'm more than happy to try to address those at this time.
And if you're calling in to unmute yourself, it's *6. And then you can also utilize the chat feature if you're joining on your computer.
See the chat.
You can also temporarily unmute yourself by just pressing the space bar.
We should, we did talk about a lot of these points in our for community planning process events virtually, and we did do them through our social media, including YouTube, so that it would allow individuals, if they had questions, missed any of the meetings, were able to go back and hear, listen to the information, and then submit also email questions. And so I think going back from December through now, we've had probably just 1 or 2 questions or comments during that time. And I don't know if that's just because we were clear. I don't know if maybe because this one was not a 600-page plan, so people were able to get through it easier. But yeah, I mean, if there's questions, comments, we would love to be able to get them now, just like I said, so that once the board accepts this and we move it forward for our board of supervisors, that we're compiling and putting everything in there and being able to complete it. We don't want to extend the period beyond this and then try to add any questions later. So if you've got a question, comment, if you're not sure about it, you can feel free to put it in the chat too. That allows people maybe to be more comfortable, but we're happy to answer and support any clarification anyone may need. Let's see what time it is because I have no idea. My screen is just the PowerPoint. If it's all right with you, Kylene, I'll go to the next slide, and if anyone has any questions, they can jump in. We still have about 7 minutes before we plan to wrap this up. So if you come up with a question or want to ask a question, you still have a few minutes. So just the next steps, we wanted to review just the next steps. So as Kylene mentioned, our chair mentioned that, at the upcoming behavioral board meeting here in a few minutes, the board will vote on our accepting the annual update. We'll go back and make final grammatical format edits. We'll add the appendices, which include some of the budget information that we've had to submit to the state, as well as any questions or comments we were going to receive today in there. But the content of what's in the plan is not going to change from what has been posted. So it's literally just going to be grammar format. We're not adding or taking anything out. And we are then going to submit the plan to the Board of Supes. Once that's approved, we will post it to our website. And then within 30 days of our Board of Supervisors approving the plan, we do have to submit it to the state. So we will work to do that. Now, the good news is we're really close to getting this annual update done and submitted, and we'll be in a good spot. And I don't want to say it's a bad news, but the next bit of news is that starting July 1, 2022, we're in our final year of our 3-year plan, which means we get to do this all over again and plan our new 3-year plan, which will be due by June 30th of 2023. However, going through a really successful pre-COVID community planning process, and I think Fresno has just historically done a fantastic job with our community planning process, going back to the very beginning, having a lot of community forums, having a lot of opportunities for community to provide input and be involved in the process. And so we want to continue that precedent. So we're going to be working hopefully here as soon as we're done with submitting this plan to the state to start kind of planning our next 3-year plan. And by that, I mean, not that plan itself, but working on the logistics as far as where are we going to have forums? Are we going to be able to do things in person or not? If we're doing virtual, how do we maximize opportunities? Doing again training, working on allowing for maximum input, and then also setting together a timeline so that we can make sure we're completing all the community input, but also getting the plan written and done. Because if we don't have our plan in by June 30th 2023, we technically don't have any authority to spend any of that MHSA money. So we do not want to have our entire, at least the portions of our system of care that are funded either in part or entirely by MHSA come just reaching halt. So we're really cognizant of that. We want to do some pre-planning, and so that come July 1, we'll start working on that and getting that plan done in time and keeping the services and the programs and everything we have continuing forward. So, so that's just kind of what'll be happening next. We still have about 5 minutes. If anyone has any questions or comments or anything that we can clarify, either on an annual update or anything else that I've spoken to today before we, I guess, would adjourn or wrap up this portion.
Thank you, Ahmad. Yes, open for public comment, and just note again that we will have it open again for public comment during our Behavioral Health Board meeting, but you have the opportunity to do so now.
This is the first time I think we haven't had questions or comments at the hearing. And like I said, the information on the plans are public. What we'll take down for the minutes just because we want to not clean it up. But as we get ready to take that to board, we'll have that back up on the website if people want to reference it or look at it. And if there's ever a question that's a public document, hey, you know what? Can you send me the copy of the plan? If it's not on the website, we can always send that out to people as well. But it'll be down probably just for a couple of weeks as we try to pretty it up a little bit.
You did such a good job that there are no questions. So
I'm hoping that's what it was, Carolyn. But no, the credit goes to our team, Aaron and Tammy on the fiscal side, and they have worked on this for past several months, putting it all together, pulling all the reports, all the staff analysts from contracts that we send them all the forms and hey, fill this out, give us the numbers, put the budgets in here, update this. So no, it's definitely a team effort, and we really appreciate everyone's working hard to get that information to us so we can get this plan. Because in the end, getting these plans done on time benefit all of us, because without it, technically the state could say your plan is not approved, you don't have spending authority, and that would be really bad for all of us. So that's why I appreciate everyone being cognizant of the importance of us getting these plans done. But yeah, if there's no other questions, Kylene, we're done with our part, and we will turn that over to you guys for the next step.
Great, thank you again, Ahmad. Again, our regular Behavioral Health Board meeting starts at 3:30, but I will officially adjourn this current public hearing. So all of you have a long period of 2 minutes before our next meeting. If you want to, take a break during then, I will see you in about 2 minutes. Thank you again, Ahmad.